Hey, so all welcome back to my YouTube channel. Today we are going to discuss about what is larynx. Okay, basically, what is the location? Firstly, it is found at the region of C3 to that of C6. You should remember the region. Okay, what is the size of larynx? It differs basically in males as well as in females. In the males, it is 44 mm long, and in the case of females, it is 36 mm of long. Okay, basically larynx consists of cartilages. Basically it have 9 cartilages. Okay, among the 9 cartilages, 3 pair of them are 3 and 3. 3 are paired and 3 of them are unpaired. Okay, how you can remember the unpaired and the paired cartilage? First of all, let's begin with unpaired cartilage. You can remember it with ETC. Okay, like E is the epiglottis, T is our thyroid cartilage, and C is our cricoid cartilage. Cricoid cartilage. Okay, you can remember the 3 unpaired cartilage with the mnemonic etc. ETC: epiglottis, thyroid cartilage, and cricoid cartilage. Now let's begin with paired. Paired is ACC. Okay, what does A stand for? Arytenoid cartilage, corniculate cartilage, and cuneiform cartilage. Okay, these are the 3 paired cartilages. Let's revise it again. There are 3 paired and 3 unpaired. 3 unpaired you can remember with etc. E stands for epiglottis, T is the thyroid cartilage, and C is our cricoid cartilage. While in the paired one there are ACC: arytenoid cartilage, corniculate cartilage, and cuneiform cartilage. Like thyroid cartilage has the different position or the different angle with respect to male and females. They have an angle of 90 degree, placed at an angle of 90 degree in the case of males, and in the case of females at 120 degree. Basically epiglottis is leaf like. It has 2 parts. This is the upper part and this is the lower part. This is upper part and this is lower part. Okay, upper part of it is free, while the lower part of it is attached to median thyroepiglottic ligament. You should remember the ligament to which the lower part of epiglottis is attached. Okay, and the cricoid cartilage basically has 2 parts. Firstly it is anterior and then it is posterior. Anterior part of it is the arch, and the posterior part of it is called as lamina. Okay, you have to remember some brief descriptions about the 3 unpaired cartilages. Epiglottis has the 2 parts. One is the upper free part and the lower that is attached to the ligament, the median thyroepiglottic ligament. And thyroid cartilage have different angles with respect to males and females. In the male they have an angle of 90 degree, while in the case of female they have an angle of 120 degree. As per the cricoid cartilage, they have the 2 parts. One is the anterior and another is the posterior. Anterior part is attached to the arch and the posterior part of it is attached to the lamina. Okay, now let's begin with 3 unpaired cartilage. What is arytenoid cartilage? Basically it has a pyramidal shape. Okay, and where it is attached or where it is found, basically its location is on lamina of cricoid cartilage. What is lamina of cricoid cartilage? Basically it is the posterior part of cricoid cartilage that I have mentioned here also. Okay, so these 2 points you should remember about arytenoid cartilage. Firstly it is pyramidal in shape and is attached to the posterior or the lamina part of the cricoid cartilage. Next, what are the corniculate and cuneiform? The cuneiform one is also called as crucible. Okay, and the corniculate is also called as Santorini. Okay, so basically these are the cartilages. Firstly, what we have studied, that what is the location, it is C3 to C6 region. What is the size of it, it is 44 millimeter long in the males and 36 millimeter long in the case of females. Then we have studied about the cartilages. In toto, there are 9 cartilages, 3 of them are paired and 3 of them are unpaired. Unpaired one are ETC, epiglottis, thyroid and the cricoid cartilage, and the paired one are ACC, arytenoid, corniculate and cuneiform. Arytenoid is attached to the posterior part of the cricoid cartilage and it is pyramidal in shape, while epiglottis has a two part, upper and the lower. Lower one is attached to the ligament that is called as median thyroepiglottic ligament, and the cricoid cartilage has the two parts, anterior one and the posterior one. Anterior is called as the arch and the posterior of it is called as lamina. Okay, next we will see what is the, as per histological section, what are the hyaline cartilages and what is the elastic cartilage. Okay, hyaline cartilage basically involves our thyroid cartilage, cricoid cartilage and arytenoid cartilage. These are the 3 hyaline cartilages. Rest all mentioned above in the above as 9 cartilages. Amongst the 3 are hyaline and rest all will be elastic cartilage. Okay, as per histology, that is the hyaline cartilage and elastic cartilage. Now let's begin with the joints. What are the joints of larynx? Basically we have the 2 joints. Firstly, it is the cricotracheal joint. It can be the cricothyroid joint and cricoarytenoid joint. Arytenoid joint. Just like a TMJ joint, that is the temporomandibular joint, it helps our the movement of the mandible. Say the joints of the larynx also helps movement in different directions. As per the name suggests, cricothyroid, it allows the movement in transverse axis. How you can remember it allows movement in transverse axis? In the cricothyroid joint, the term T comes, so you can remember it allows movement in transverse axis. Okay, and in the case of cricoarytenoid joint, it allows movement in vertical axis. And most importantly, these both are synovial joints. Okay, just like our temporomandibular joint. So these were the joints of larynx. Okay, so next what we are going to study is about what are the ligaments. What are the ligaments? Basically we have extrinsic ligament and intrinsic ligament. Okay, what are the extrinsic ligament? You can remember within the morning, HTC. What does HTC stand for? First of all, it is hyoepiglottic ligament. It can either be thyrohyoid ligament or it can either be cricotracheal ligament. Okay, then what are the extrinsic ligaments? What are the intrinsic? Extrinsic are the 3 HTC. It can either be hyoepiglottic, it can either be thyrohyoid or it can either be cricotracheal ligament. Then what were the joints? Joints were cricothyroid and cricoarytenoid. What are the extrinsic ligament? I am drawing one diagram here for all of you. You should look for that diagram. Okay, Suppose this point is our epiglottis. Okay, this area, the above area, and this area, the below area. Above one is called as vestibular fold, and the below one is called as vocal fold. Okay, and anterior to this line we have a cartilage that is called cricothyroid ligament. Not a cartilage but a ligament. Okay, and the space between the vestibular fold and the vocal fold is called as, this space is called as sinus of larynx. So this one, above one is called as quadrate membrane, and lower one is called as conus elasticus. Okay, so from the diagram we can see the intrinsic part, the intrinsic ligament. Firstly we will discuss about the quadrate membrane. Quadrate membrane, and this part, the posterior part of it is called as arytenoid cartilage. Okay, and this upper border of it is called as arytenoid fold. Okay, upper part is called quadrate membrane, lower part is called conus elasticus. The upper fold is called vestibular fold and the lower fold is called as vocal fold, and the space between the vestibular fold and the vocal fold is called sinus of the larynx. Okay, so firstly we will begin from quadrate membrane. So basically this quadrate membrane, what is the extension of this? We will study the extension. It extends from arytenoid cartilage to epiglottis. Okay, it extends from arytenoid cartilage to that of the epiglottis. Basically quadrate membrane has two borders, the upper border and the lower border. Okay, it has two border, upper border and lower border. Upper border is called as, this is the upper border, and this one is the lower border. So upper border is called, I mentioned it here, it is epiglottic. Okay, upper border is called epiglottic fold. Okay, and lower border is called as vestibular fold. Okay, these were the extension and the boundaries of the quadrate membrane. So quadrate membrane basically extends from this arytenoid cartilage to that of the epiglottis, and they have two parts, upper and lower. Upper is the epiglottic fold and lower one is the vestibular fold. Okay, so next we are going to discuss about what is conus elasticus. Same to the quadrate membrane. Now we will discuss about conus elasticus. Okay, conus elasticus also have, this is the anterior part and this is the upper part. Okay, anterior part of it is called as cricothyroid ligament, and the posterior part of, sorry, not the posterior part, upper part of it is vocal fold. You have to remember this and this properly. This were all about the ligaments. So next we will study about them once again. The extrinsic ligaments you can remember with HTC. H stands for hyoepiglottic ligament. T stands for thyroid and C stands for cricotracheal ligament. What are the intrinsic ligament? Firstly, you should remember about the quadrate membrane and the conus elasticus. Quadrate membrane extends from arytenoid cartilage to epiglottis, and they have the upper fold and lower fold. Upper fold is called aryepiglottic fold and lower fold is called as vestibular fold. Similar to conus elasticus, they have the anterior part that is called as cricothyroid ligament, and the upper part of it is called as vocal fold. Okay, and upper part of it is called as the vocal fold. So basically these were the ligaments. Okay, now we will study what is rima glottidis and rima vestibularis. Okay, the term where I have mentioned is the vestibular fold and the vocal fold. Okay, space between two vestibular fold and space between two vocal fold are named differently. So you should learn what are the two different names for them. The space between the two vestibular folds are called as rima vestibularis, and the space between the two vocal folds are called rima glottidis. Okay, two vestibular fold and two vocal folds. Space between the two vestibular fold is called as the rima vestibularis, and space between the two vocal fold are called as rima glottidis. Okay, now there are different shapes of the rima glottidis that you need to learn. Okay, what are the different shapes of rima glottidis? Different shapes. What are the different shapes of rima glottidis? First of all, during quiet breathing. What does it mean during quiet breathing? It means that whenever you are sitting or you are studying, that is the quiet breathing. The shape of it is pentagonal. Okay. Then what is the shape of it during speech? When you are saying something, like I am delivering the lecture. So the shape of it will be straight, that is the linear shape. Okay. Then what will be its shape during forced inspiration? During forced inspiration, it will be somewhat diamond shaped. And at the last, when we are talking to our friends, what will be its shape? It will be somewhat this. This is funnel shaped. Okay. So you should remember the different shapes during the different activities. Okay. Remember it very carefully. What are the different shapes of rima glottidis? When during the quiet breathing, it is pentagonal in shape. During the speech, it is linear in shape. During the whispering, it is funnel shaped, and during the forced inspiration, it is diamond shaped. Okay. Then there are different muscles of the larynx that we need to learn. Okay. Different muscles of larynx. What are the different muscles of larynx? I will mention all the muscles of larynx to you, but along with their function. So first of all, what are the muscles of larynx that are associated with elevation? What are the muscles associated with depression? Elevation are done with mylohyoid and thyrohyoid. Sorry, wait for a second. Sorry for the disturbance. What are the different muscle of larynx? Depression of it is, sorry, elevation is done with mylohyoid and thyroid. Okay. Depression is done with the help of sternohyoid and sternothyroid. Okay. Another is the opening of inlet and closing of inlet. Opening of inlet is done with thyroepiglottic and closing of inlet is done with ariepiglottic. Okay. Elevation is done with the help of mylohyoid and thyroid. Depression is done with the help of sternohyoid and sternothyroid. Opening of the inlet is done with help of, you should remember, how you can remember I will tell you in the last. Opening inlet is done with the help of thyroepiglottic and closing of the inlet is done with the help of ariepiglottic. Now what are the abductor muscles and what are the adductor muscles? Abductor muscle is called as posterior cricoarytenoid, and adductor muscles you can remember with LOT. I will tell you LOT what it is. It is a lateral muscle, oblique muscle, and transverse muscles. Okay. Then what are the tensor group of muscles and what are the relaxer group of muscles? Tensor group of muscles are cricothyroid and relaxer group of muscles are thyroarytenoid along with vocalis. The point arises how you should learn this. You have to remember these muscles of larynx very importantly. Okay. Elevation of it is done with the help of mylohyoid and thyroid. Depression is done with the help of sternohyoid and sternothyroid. Opening of inlet is done with the help of thyroepiglottic. You can remember with the word OT, operation theaters now. So it is opening is done with the help of thyroepiglottic. Closing is done with the help of CA. Closing is done with the help of ariepiglottic fold. What is the abductor? Abductor and adductor, you should remember it very carefully. Abductor is the posterior cricoarytenoid and adductor are three muscles: lateral muscle, oblique muscles, and transverse group of muscles. Okay. Tensor is the cricothyroid and relaxers are the vocalis and the thyroarytenoid. You have to remember these muscles along with their actions very carefully. Okay. Elevation are done with the help of two group of muscles. Firstly, it is mylohyoid and thyroid. Depression is done with the help of sternohyoid and sternothyroid. Inlet is opened with the help of thyroepiglottic fold. Okay. Closing of inlet is done with the help of ariepiglottic. Adductor, abductor. Abductor is our posterior cricoarytenoid and adductor is our lateral group of muscles, oblique group of muscles, and transverse group of muscles. Tensor are the cricothyroid and relaxer are the vocalis and thyroarytenoid. So these are the different muscles of larynx along with their action that you should remember. Okay. Next, most importantly, what we are going to study is about blood supply of larynx. Blood supply of larynx. Suppose this is our vocal fold. What is vocal fold? That I have already mentioned. Basically, it is the upper part seen in the case of conus membrane. Okay. Blood supply above to the vocal cord is different and below to the vocal cord is different. Above to the vocal cord, the blood supply is with the help of superior laryngeal artery and below it is with the help of internal laryngeal artery. Superior laryngeal artery or the internal laryngeal artery. Superior laryngeal artery basically is a branch of superficial thyroid artery or branch of superficial thyroid artery. And this superficial thyroid artery we have mentioned it as a terminal branch of external carotid artery. I have mentioned the terminal branches, maxillary artery and superficial thyroid artery or superior thyroid artery. You can study there. So basically the nerve supply above to the vocal cord is with the help of superior laryngeal artery. You should remember this only. If you can remember the following, you can remember. Superior thyroid artery is the nerve supply above to the blood supply above to the vocal cord, and superior thyroid artery is the branch of external carotid artery. Okay. Then below to the vocal cord, the blood supplies with the help of internal laryngeal artery. Okay. Internal laryngeal artery is a branch of thyroid artery, internal thyroid artery, and this internal thyroid artery is a branch of thyrocervical trunk. Thyrocervical trunk, and the thyrocervical trunk is by the subclavian artery. So subclavian artery basically involves our 4 branches. What are the 4 branches of subclavian artery? You can remember with the word Vito. V-I-T or O. That is Vito. V stands for vertebral artery. Vertebral artery. I stands for internal thoracic artery. T stands for thyrocervical trunk, and O stands for osteocervical trunk. So basically our subclavian artery has 4 branches. You can remember it with the mnemonic Vito. V stands for the vertebral artery, I stands for the internal thoracic artery, T stands for the thyrocervical trunk, and O stands for the osteocervical trunk. Further, this thyrocervical trunk has 3 branches. This thyrocervical trunk has 3 branches. What are the 3 branches of thyrocervical trunk? You can remember it very easily with the mnemonic SIT. Okay, that is SIT. S stands for suprascapular. Then it is inferior. Sorry for the disturbance. Okay, it is suprascapular, then it is inferior thyroid, and then it is transverse cervical. Okay, these are the branches of thyrocervical trunk. Let's memorize the blood supply of larynx again. Above to it is with the help of superior laryngeal artery, and below to the vocal cord is with the help of internal laryngeal artery. You should remember these 2 things basically. If you can remember further, you should remember. Okay, basically the superior laryngeal artery is a branch of superior thyroid artery, and superior thyroid artery itself is a branch of external carotid artery. Okay, next, below to the vocal cord we have mentioned the internal thyroid artery, internal laryngeal artery, which is a branch of internal thyroid artery, and this itself includes the thyrocervical trunk. Subclavian artery has 4 branches, namely Vito. V stands for vertebral artery, I stands for internal thoracic artery, T stands for thyrocervical trunk, and O stands for osteocervical trunk. Further, thyrocervical trunk has further 3 branches that you can remember with the word SIT. S stands for suprascapular, I stands for internal thoracic, and T stands for transverse cervical. Okay, this was the blood supply. Now let's begin with the nerve supply. Nerve supply of the larynx. Okay, now we are beginning with nerve supply of larynx. Basically they have the 2 parts, sensory nerve supply and motor nerve supply. Firstly, begin with sensory nerve supply. Similar to the blood supply, we will study this. This is our vocal cord. Okay, above to the vocal cord and below to the vocal cord. Above to vocal cord, they are supplied with the help of internal laryngeal nerve, and below with the help of superior laryngeal nerve. Okay, sorry, I mentioned it somewhat. It is not, it is recurrent laryngeal nerve. I will correct it for all of you. Above to it is with the help of internal laryngeal nerve, and below it is with the help of recurrent laryngeal nerve. Okay. Motor nerve supply is also with the help of recurrent laryngeal nerve, except cricothyroid muscle. Cricothyroid muscle is not supplied by recurrent laryngeal nerve. That you should remember. Okay. Nerve supply are sensory and motor. Above to the vocal cord is with the help of internal laryngeal nerve, and below to the vocal cord is with the help of recurrent laryngeal nerve. And motor nerve supply involves the recurrent laryngeal nerve, but the cricothyroid muscle is not supplied with our recurrent laryngeal nerve. Okay. Then some important points for internal laryngeal nerve, external laryngeal nerve, and recurrent laryngeal nerve. So let's begin with some important points. Okay. First of all, internal laryngeal, external laryngeal nerve, and recurrent laryngeal nerve. What happens when damage to them occurs? Okay, you should remember what can happen if there is a damage. First of all, in the case of internal laryngeal nerve, then there will be anesthesia of larynx. Okay. In the external laryngeal nerve, there will be loss of timbre of voice, and when damage to the recurrent laryngeal nerve, there will be the hoarseness of voice. Okay, you should remember these. Firstly, it is the hoarseness in the case of recurrent laryngeal nerve. In the external laryngeal nerve, there is loss of timbre of voice, and in the case of internal laryngeal nerve, there is anesthesia of the larynx. These you should remember very well. Okay. Internal laryngeal nerve causes anesthesia of the larynx. External laryngeal nerve causes loss of timbre of voice, and recurrent laryngeal nerve can lead to hoarseness of voice. So this was all about the larynx. Whenever the question, this can be asked in your theory paper either for 15 marks or for the 5 marks, but you should always remember, whenever you write down any question, diagram is very must. These small diagram you can also draw, but from your BDC Chaurasya there will be a proper well labeled diagram of larynx. You should try to make in your rough notebooks, and always draw the diagram in exams. Okay. So this was all about larynx. This was basic about how you should write a question. Here I am mentioning. First of all, you should consist of its introduction. Like in the larynx, some introduction. You should mention about joints, any cartilages. Very importantly, you should mention about, in every question, whether it is parotid gland, submandibular gland, head and neck, blood supply, nerve supply, and venous supply. This all is important. You should mention in each and every question. The rest of the things you will mention only, but you should remember the blood supply, nerve supply, and venous supply. Without this, the question is incomplete, as the examiner will give marks to you on the basis of this only, that as anatomy is all about the blood supply, venous supply, nerve supply. So please, in every question you should write with headings, proper headings, to describe any answer. Diagram is very important, so you should draw the diagram. Okay. So this was all about the larynx. Starting from this was the introduction of larynx. Then we learned about the cartilages of larynx. This was about the cartilage. Then we studied about the histologic involving the hyaline cartilage and the elastic cartilage. Then what were the two joints? It was cricothyroid and the cricoarytenoid joint. Okay. Next we studied the ligaments, that are the extrinsic one and the intrinsic ligaments. Okay. After the ligaments, you can draw this diagram also. Please remember the intrinsic and the extrinsic ligament very well. Then we have different shapes of rima glottidis. Okay, you should remember this also very well. Then different muscles. This part, the muscles of it, is very important. It can also be asked in your MCQ pattern. What is the adductor muscle? What is the abductor muscle? Okay. And opening is done with the help of, closing is done with the help of, opening is done with the help of thyroepiglottic, and closing is done with the help of aryepiglottic. You should remember about the blood supply and the nerve supply, and different damages can lead to what? Internal laryngeal nerve can lead to the damage, anesthesia of the larynx. External laryngeal nerve can lead to loss of timbre of voice, and recurrent laryngeal nerve can lead to hoarseness of voice. Okay. And you should remember that a recurrent laryngeal nerve supplies to all the muscles of the larynx except to that of the cricothyroid. Okay. This is all about the larynx, so you should remember all the points very well. Okay. So please do like, share and subscribe to my channel. If you want more such informative videos, please give me a chat box for any kind of suggestion that you want me to improve. Okay. So thank you for watching. This was all about larynx. It is a very important topic. Okay. You should once again remember that it is very important. It can come either for 15 marks or the 5 marks about the ligaments or all. So please remember the larynx very well. Okay. So thank you for watching.